Good afternoon, everyone. Welcome to this special event for Seniors Month at Cayfield Wesleyan Holiness Church. This event is a very important event because it has to do with health. And as they say, health is wealth. So no matter how much money you might have and you don't have health, then your wealth will be in trouble. So this afternoon, we have with us a very special guest who will be presenting health issues that would impact every single one of us, whether you're a senior or a junior. And this afternoon, our special guest is Dr. Adrian Lord. He's a family physician, and he's involved in other aspects of medicine, such as sports medicine. He's right at the top there, and in the sports medicine fraternity, and also the Olympic Association as well. And also, he also has to do with the drugs in terms of sports athletes. So he's very involved in this. So he'll be here and he'll present to us matters affecting particularly the health of seniors. But of course, as I said, seniors will not be the only ones who will be impacted. He'll be looking at NCDs, and this is something that is very, very critical in our society. So we will now hand over to Dr. Adrian Lord, and he will make his presentation, and an opportunity will come to you to interact, ask him any questions, and of course, I'm sure he will have answers for you. Dr. Lord.
Good afternoon, all. Thanks for having me back here again. The pastor and members of this church. It's interesting that this year, the theme for Caribbean Wellness Day, which is always held on the second Wednesdays in September, is our neighborhood, our health. And I'm a member of the neighborhood of this church. My office just down the road, so we are in the neighborhood. I attend a neighborhood church, Church of Christ the King. And it's interesting that tomorrow I'm going to have some big duties to perform there. Our rector resigned, and we have visiting priests. So, Pastor, if you want to join the Anglican Communion, please come over. Our gain will be your loss. But yeah, so we have a canon coming over tomorrow, and I will be robing as the Eucharistic minister to welcome him. And it's interesting that he's not going to be giving communion tomorrow. He's asked the Eucharistic ministers to do such. Although I was trained during the pandemic. So I have not really had the experience of handing out the body or blood of Jesus, our Lord Jesus Christ. So tomorrow, you never know, I might be asked to do the body. So I have to make sure I'm on my P's and Q's and make sure I do everything right I have to do tomorrow at church. Right, so our health, our neighborhood. And as you know, there's several other activities. This morning, I took part in what I thought was a 5K sponsored walk. But when I did the walk, it was 6.7 Ks. I, however, completed it in 1 hour and 1 minute. I went to work. I just left work. But I had something to eat. You know what we get on Saturdays, right? So chronic NCDs, chronic non-communicable diseases, are really diseases of long duration. And generally they are slow in progression. They're responsible for about 70% of deaths worldwide. They may be silent, so you may have no symptoms at all at first. And they may require long-lasting treatment. In other words, the treatment, a lot of people say, well, I have to be on this for my life. Yeah, because if you don't, your life might be shortened. And one guy told me recently, everybody has an expiry date. I said, well, I want you to live to your expiry date. I don't want you to expire before that date. They may be related to lifestyles. A lot of them are inherited, and they're largely preventable or easily treatable, or will be controlled but not cured. They say in Barbados, I heard Minister Sonia Brown say recently it costs us $350 million Barbados dollars annually to treat the chronic NCDs here. So I haven't defined chronic NCDs. I thought I defined what elderly. And the definitions I have been able to garner says that a person over the age of 65, but they all say it's a polite word for old. The World Health Organization predicts that by the year 2050, those over the age of 60 will double in numbers. And those over the age of 80 worldwide will be something like 400 million persons. So the more medication, the more access to health and health services have helped people to live longer. In the past, we didn't have that access. But people were very active. Now people are less active, but we have access to health and medication. But now everybody questions the medication. Should I take this? How long do I need to take it? Now, we're in the middle of a pandemic, and I hate when people tell me that when we had COVID-19. This is just the eye of the storm. Another wave might well come. So please don't be complacent, because we're getting a number of persons who are dying from COVID-19. Most of them have chronic non-communicable diseases. Most of them are elderly. And most of these conditions, when the virus hit them, they're not well controlled. The sugars are high already before the disease hit them. Blood pressures are high, cholesterol is high. And the virus just loves that, because normally when it hits you, it can cause your blood pressure to go up, can cause your blood sugar to go up. And if it's up already, and you're near the edge of the cliff, you're going to fall over. Many persons in that elderly category are not vaccinated. Or if they're vaccinated, they were told that once you have 2 shots, you're fully vaccinated, but it's not true. You would have received your first series of vaccines. Your immunity is down, so you need to be boosted. Or they say, I don't go nowhere. Well, the people, the family members, go other places and bring it home to them. Some, when they get symptoms, is not recognized, or when it's recognized too late. And this slide here, I copied from former central bank governor Delisle Worrell, and he showed that between April and June of this year, the deaths were all in the ages of 92, 94, 70-something. There were only 2 persons in the category the lower category, which they were 29, one person aged 29 and one person aged 44, but all of them were in the older age group. That is what the slide intended to say. So, what are the chronic NCDs? Heart attacks and stroke, cancer, chronic respiratory diseases like asthma, diabetes, chronic kidney disease, and they've added now mental health as the 5 main NCDs. The risk factors are increased tobacco use. Now, people don't smoke cigarettes anymore, or use of cigarettes have decreased. I can hardly find anybody who tells me that they smoke cigarettes. They smoke marijuana. So the marijuana has taken the place of that. Physical inactivity and obesity, the abuse of alcohol and unhealthy diets, all those increase the risk of NCDs. So if you look at the heart diseases or cardiovascular diseases, and you talk about high blood pressure is the force that is placed inside the blood vessels by the heart when it pumps. And you have the top number, which is the systolic, where the heart pumps, and when it relaxes is the diastolic. So those are the two numbers that you get. And if you look at this diagram, you can see what is normal. Normal is in green, and the 120 over 80 is still considered to be normal. 130 over between 130 and 80 is what we call elevated blood pressures. Between 130 and 140 over 90, that is stage 1 hypertension, and over 140 over 90 is stage 2. If it's like over 180, over 120, and you're still living, it is a severe emergency hypertensive crisis that we're talking about. The complications of high blood pressure, most times there are no symptoms of high blood pressure, but the complications include heart attack, stroke, kidney disease, blindness, can affect the eyes, ruptured blood vessels, impairment of brain function, and of course death. And those are by lowering the blood pressure, your risk and the incidence of stroke and heart attack and heart failure are reduced. And treatment is prevention by reducing your salt intake, eating a balanced diet, avoid abuse of alcohol, get regular exercise, and avoid tobacco use. Of course, the part that people don't like, medication. Heart disease is really damage to the heart blood vessels, coronary heart disease. And that's usually due to the cholesterol inside the heart blood vessels, causing plaque accumulation in the various blood vessels. So this is a cholesterol plaque, and you can see that the circulation is being affected. It's a narrow way to get through there. One-way traffic, where the two-way the place blocked up, right? And when it happens like this, it can lead to a buildup in the arteries called atherosclerosis, a high level of the bad cholesterol, which is the LDL cholesterol, and then you get angina, heart attack, and can lead to death. But if the heart doesn't get any blood, the heart dies. It affects all population groups, and we are seeing already in our children, we're having children who are presented with heart disease, coronary heart disease, and they're not born with it, but because of their lifestyles and the obesity and the sugar and sweetened beverages that they drink, then they're having a higher incidence of coronary artery disease. It affects women quite commonly, and women are usually not regularly or easily diagnosed because, like men too, we all think it's just gas. And the elderly, of course, are more vulnerable. Let's go on quickly to diabetes. As really high blood sugar in Barbados is seen in 17.5% of persons over the age of 40. Right? So, but we also see it in the younger children as well. But over age 40, 17%, almost 1 in 5 persons in Barbados are diabetic. So if we have 5 people in here, at least 1 is diabetic. If we have 10, at least 2. And there are different types of diabetes. You hear about type 1 diabetes, where the body is not producing enough insulin, the pancreas, or type 2 diabetes, where the insulin that's being produced is not effective in causing the blood sugars to go down. Or in gestational diabetes is where women get diabetes during pregnancy because of the large hormones, and high blood sugar levels could affect the fetus. And there are other types of diabetes, drug-induced diabetes and so on, you could get if you're taking steroids and so on. Yeah? You can.
With respect to the gestational diabetes, does it go after the person has delivered their baby, or is it something that has to be looked at afterwards?
Yeah. The fetus is what causes, and the hormone levels in pregnancy is what causes the diabetes to be present. But once you deliver that baby, the diabetes goes away. However, they are very likely to develop diabetes later in life, especially if lifestyle is not maintained. And the risk factors include things like physical inactivity, overweight and obesity, high fat diets, low birth weight, ethnicity, and it's very common in black persons, of course. If you have a family history of diabetes, you're at increased risk with becoming diabetic. Urbanization, and that means that everybody lives in more a city type environment and not in the country type. Look at Warrens, how Warrens have developed. And of course, the other thing is age. The older you get, the more likely it is that you could become diabetic. If you have family history, if you have all these other factors involved. And the symptoms, there may be none. Or there could be increased thirst, frequent urination, unexplained weight loss, extreme hunger, tingling and numbness in the arms and the legs, dry skin, fatigue, cuts, sores that are slow to heal, more infections than usual, or nausea, vomiting, and stomach pains. These are symptoms that could be caused by a number of different other conditions as well. So it's not specific to it, but if you do this, you will know that you are like diabetic.
Is it possible to reverse diabetes?
Yes, and here in Barbados, there have been some studies where they have successfully reversed diabetes. The Heart and Stroke Foundation and the Chronic Disease Research Center, now called the George Alley Chronic Disease Research Center, they have been successful in reversing diabetes in persons with restricted diets of things like 1,200 and 800 calories per day. And a hamburger alone is probably more than that. Restricted diet and increased exercise, they have successfully reversed diabetes in a number of persons that they studied a few years ago.
I think it was Father Harcourt that had gone to Loma Linda. The Adventists are very much into health issues. And I know that they preach a lot of reversal, but I didn't hear it in Barbados.
Yeah, they have been successful. I don't know what has happened down the line because people are not disciplined enough to continue to do these things. They lost weight, their blood sugars came down, their blood pressures came down. But of course, when we do that, then we start to relax, like how we're relaxing now in the pandemic, then things can reverse forward.
I'm asking another question. If you are pre-diabetic, will you definitely go on to become a diabetic?
If you continue to do the things that you've been doing. Pre-diabetic is a warning light.
Okay.
And if you see that you are pre-diabetic, you need to put the brakes on and get exercise, do some weight, cut out the sugars, and you can stall off that for a long time.
For a long time. I asked that question because my mother, they told her so about 35 years ago. And she never moved from that position,
Right.
but she has never changed her diet either. And she was never a fast person, so activities out the question. But she's now 89, so she has maintained that nearly 40 years now.
Very good.
So,
Yeah. So there are a lot of complications of diabetes. Diabetes is a vascular disease. It's an inflammatory disease. So it can affect all the blood vessels at various parts of the body. It can cause clotting in the arteries. It can cause stroke, heart attack, excess deposition of fatty fats on the skin and so on. It affects the kidneys, the lungs, the circulatory system, because you hear about poor circulation, ulcers and amputations as a result. Of course, the genital areas in the female, they get frequent vaginal infections, but the males just do not rise to the occasion when asked to do so. Erectile dysfunction. Management is prevention, physical activity, weight loss, healthy eating, and medication as appropriate. That was not my lunch today. High cholesterol, let's put. Let's put in a sauce. Beer cholesterol, and salt, and sugar, and carbohydrates too. But there's some vegetables in there. You see the vegetable matter? So causes is there again: sedentary lifestyles, obesity, smoking, genetics, and a lot of people who have been diagnosed. I have diagnosed personally with high cholesterol. I don't eat this, I don't eat that, but still my cholesterol high. I don't smoke, I'm not overweight, I don't have high. Most of them may have either diabetes or hypertension. I don't have kidney disease or liver disease or thyroid disease. But the point is genetics. They inherit it from their parents. But my mother and father didn't have it. You sure that he was your father though? But sometimes it may not be that parent. But if you ask the sisters, you find that sisters and brothers may also be on medication or have high cholesterol. And that's a silent killer. And when I see persons who are diabetic, I always check the cholesterol or hypertension because the three musketeers, high blood pressure, diabetes, and high cholesterol, they all go together. Tend to go together. And symptoms, as again, as I said, most of these things are silent. So there may be no symptoms, or as a result of the narrowed blood vessels going to the heart, you get angina. There's a little pain or burning in the chest on exercise, and you stop. Nothing happens. And it relaxes, and you start back exercising, and it happens. Or same thing with leg pain. It's something called intermittent claudication, where when you walk from here, if you're going to the supermarket, you have to stop a few times because circulation is not down there. When you stop, you're okay, and then you move on again. So leg pain, when active, blood clots, which is due to the narrowing of the blood vessels. This is normal blood vessel, but when the cholesterol plaque goes in, it causes it to be narrow, so less circulation going to various areas. And they can rupture and move from there and go to the brain and the lungs and cause heart attacks. And there's some patches that we can see on the skin sometimes. Dangers is of course, atherosclerosis, which is hardening of the arteries, heart disease, as we mentioned, heart attack, angina, high blood pressure, because if it makes the blood vessels hard, then it can cause you to get high blood pressure. Stroke or mini stroke. Mini strokes are something called transient ischemic attacks, which last about 24 hours, where you get it almost a full-fledged stroke, and within 24 hours, you're back to normal. You don't have anything, you have a little slurring of speech initially, and then it goes away. Or sudden death if you're unlucky. And treatment is, again, lifestyle changes. Early same treatment. Eat a lot of fruits and vegetables, oats and good quality fats. Avoid foods with saturated fat. Get adequate rest. Reduction of weight. Avoid the alcohol and smoking. And then medication. Aspirin thins the blood. And the cholesterol lowering drugs also help to try to suck up that bad cholesterol. Now, a lot of people get scared for statins. I don't want to go on that because I hear they have side effects, but all medication has side effects. Aspirin can cause it to bleed to death, but aspirin thins the blood and can prevent it from death. Aspirin can cause your throat to swell up and you can't breathe, but aspirin also has some good effects. It can cause. If I run across the road, I might get knocked down, or I might not. You don't take the chance, but chances of getting these side effects from the statins are minimal. And most of my patients who have been on statins have done pretty well, and they're able to live towards their expiry date. Cancer, you're hearing more and more cancer. Different types of cancer: the breast, prostate, breast, cervix, colon, stomach, blood, skin, and there are cancers of almost any organ that are occurring. And in men, prostate cancer, as I always say, is a good cancer to get because you can detect it early and it can be treated and cured without any problems thereafter. A good survival. But still, time and time again, we're hearing persons who are dying from prostate cancer. I don't think you should really die from prostate cancer. You should really die from prostate cancer because detected too late. It usually goes slowly, but sometimes you can have an aggressive one. And usually it's confined to the prostate, but sometimes by the time it's diagnosed, it could be spread. And it can be easily detected by this finger, which can tell you if your prostate is cancerous, can tell you if it's enlarged, I can if it's inflamed, which is called a prostatitis. Digital rectal examination, DRE. The PSA test is a blood test for prostate cancer, but sometimes that could be misleading because it's possible that you may have a high PSA and not have prostate cancer, or you could have prostate cancer and not have a high PSA. So that, in conjunction with the PSA plus the ultrasound plus the MRI, are all methods that can be used to detect prostate cancer. There's special urine tests now that you can use that also can pick up certain things in the urine that would suggest that you have prostate cancer. And the treatment, you could watch and wait. Surveillance. Monitor by the PSAs and other tests to see if there's any changes that occur in these tests. Radiotherapy, which could be external beam radiotherapy, so you can have your prostate treated without having to remove the prostate by putting some tiny little beads into the prostate, through the rectum, and that can knock out the prostate. Hormone therapy can also be used. So there's medication that you can use to try to treat prostate cancer. It's pretty well successful, but it causes men to start developing breasts, and of course they wouldn't get up erection either. Chemotherapy can be used. Surgery, of course, there's some urologists who feel if you have prostate cancer, get it out. Then you don't have to check again. So urologists can treat it surgically. They can do it even robotic surgery now, where you get a robot to remove the prostate. Sometimes when you get the prostate removed, the problem sometimes become of incontinence of urine. You can't hold the urine. or erectile dysfunction because they may cut a nerve that may go to the penis. So it is important. So that's why some people are now going overseas and get it done robotically. I know of one person who went overseas and had his robotic surgery successfully done, but he died the next day from something else. Yeah. So the surgery was successful, but the patient died. Then there's biological surgery, there's high intensity focused ultrasound therapy. So a lot of therapies that are now in vogue that can be used to treat prostate cancer. Yeah. 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 Both places in Barbados. Yeah. Barbados is about $30,000. Yes. Yeah. Yeah, it costs.
To get it done. So has there been anything on the part of government to assist men in this area?
I don't think so. It's only done in the private sector, and if government were to take up $30,000 for every man who gets prostate cancer, the budget would bust. But there is this social welfare cost, but I don't think that they encourage it because of the cost and because there are reasonable alternatives that can be done. And those people who've done the pellets have done extremely well. I lost one patient who had pellets. I lost him, I think, yes, last year. But his cancer had gotten away by the time the pellets were inserted. He died several years after. And we can understand why the thing was going on. It actually went into the testicles. And then when he was put on the medication, the hormonal therapy, he stopped it because why? He had a young wife.
But the next thing too, do we have enough urologists in Barbados?
There are 4. Yeah. There's one that visits. He works in Maryland. He comes in and out, and there are 3 others. So we have an increasing number of urologists. Yeah, there are 4 now. We could probably do with more because it's the most common male cancer. And for the hospital to cover all these things, and of those 4, only 2 work at the hospital. Yeah, at QEH. So now in women, now you have breast cancer, and that can be detected easily by breast self-examinations. Mammograms if you're over 45. Annual mammograms. Ultrasounds may be necessary because sometimes the breast may be dense or too fatty and you can't get the ultrasounds done. Can't get the mammograms done, show it up. Or there's PT scan, which is a PET scan. It's kind of type of X-ray that is done usually to monitor the progress of persons after they've been diagnosed with breast cancer. That's done in Jamaica, Puerto Rico, I think, and maybe Trinidad. I'm not sure. It's not done here. They have to. The reason being we don't have the machine. 1, but 2, the isotope doesn't last long. So in order to do a PhD scan, they have to bring in this thing and then have to work on it almost immediately, and that's not practical in this situation. And then genetic testing, which will show you that the BRCA, BRCA gene. So there's people who are genetically likely to get breast cancer, and if they do this genetic testing, it can tell you that you are more than likely, you more likely will get breast cancer. And some women at that stage take off the breast one time. So here we have the a normal breast on mammogram, and that shows an abnormal breast right there. That is a lesion which is likely to be cancerous, and by biopsying it, we can confirm that is cancer. So breast cancer, also associated with unhealthy lifestyles, some can be detected, or this cancer generally. Cancer, unhealthy lifestyles may be detected by routine blood tests in some situations. As I mentioned, the genetic testing or PSA in men, some of it may just be incidental findings. There are persons who tested positive for COVID-19. As you know, in the early days, everybody went up north to Harson's Point. When they got out there and they were examined, because some of these people had not gone to doctors for a while, they found that they actually had cancer. On discharge, they were referred to the QEH. If they discharged, if they went to the undertaker, well, that didn't happen. But so these persons with cancers didn't know they have cancers, didn't know they have diabetes, didn't know they had these things. And when the COVID-19 hurricane hit them, then they realized that, then it was found out that they had cancers. Pap smears should be done, and nowadays they start at age 25. And if you have had a number of negative pap smears, then you can have it every 3 years. Mammograms are every once yearly still. Rectal examination and PSA testing should be done annually. And for colon cancer, there's a colonoscopy or endoscopy, which looks at the upper stomach cancers. The colonoscopies. There are other tests now. There are stool tests, such as something called M2PK test. There's also a FIT test, FIT, fecal immunochemistry. Test, yeah, FIT. These can detect in your stool if there's blood in your stool. If there's blood in the stool, depends on the level, they could suggest that it might be cancerous, but it could be polyps. It could be from bleeding gums. It could be from the ulcers as well. It could be from hemorrhoids, but at least a warning sign. So there's stool tests that can be done here now. In Caucasian people, it's good to check the skin because there's a high incidence of skin cancers in this type of environment. I mentioned the genetic testing, the PET scans earlier. There's certain chemoprotective agents such as aspirin is thought to help to prevent colorectal cancer, as we see there. So there are certain things that we can do to try to eliminate or detect cancers early. So I'm going to end on mental illnesses. So mental health and well-being is important. But as you get older, because we emphasize in the elderly, it can occur at any time in life, but it seems to be higher in the older age group. And I'm sorry to talk about COVID-19 again, but because of COVID-19, it has made things worse. About 6.6% of the total disability in this age group, in older age groups, are mental and neurological disorders. Approximately 15% of adults age 60, 60%, 15% over age 60 do have some mental disorder. There's international figures. They're really not identified by health force, by themselves, by their relatives, or the health personnel. We don't recognize that. They're there. And it's due to losses, stress, loss in your capacity to do things, loss in your capacity to walk, loss in your capacity to see, to smell, to hear. That is stress, and that could cause you to be depressed. You can't drive anymore. Remember, the first person I ever stopped driving in since I was in private practice, he was depressed because he needed to go around and see his friends. A decline in functional ability, chronic pain. Pain is stressful. become frail, you lose weight, other health problems that we mentioned before, that can be depressing. Because I mentioned that the complications of a lot of those things are death. And that's what they're seeing. And some may require long-term care. Their friends are dying. Their siblings are dying. And that scares them because they know they're next. Nobody else left. Their ability to spend is reduced because they are on pensions. And it affects their socio-economic status. And then isolation, loneliness, and psychological distress. Before we used to, at the church and the community, used to go out and visit these people. But Colonel Bossick said we should stay home. So we couldn't go out and visit these people. Some of these people don't understand why all of a sudden the body was coming to visit them. Their families visit and put things on his step. Don't spend time with them. My mother died 3 months ago. A little over 3 months, yeah. May 16th. And the longest I spent with her was the Saturday night before she died. I spent an hour, 2 hours talking to her. I didn't know that she was going. She didn't tell me anything, so. But we talk and laugh and think. I usually busy, but because she was vaccinated and boosted, and I felt more comfortable getting closer to her. And but before I was staying at the door and, "Hi, Mom, how are you doing?" So on and so forth. That's depressing. I wasn't hugging her up and all that sort of thing before. But I didn't want her to get anything that I may have passed on, as would have happened. And they don't understand because the mental capacities might be a little diminished. The priest wasn't coming around or ministers would come around and singing any songs with them. So the isolation and loneliness, yeah, we try to make phone calls, we try to do video calls, but technology is not always there. So that is stress, and that leads to mental illness. And we're going to see a lot more being unearthed now that we're back on the outside. And then there's the elder abuse, physical abuse, the financial abuse, all the other aspects of abuse of the elderly. Dementia and depression, these are all being seen even more and more now. We recognize them, but they would have escalated in the last 2.5 years. So early diagnosis and recognition of mental illnesses is very important. It's also part of the chronic NCDs. We need to optimize physical and mental health, functional ability, and well-being by getting them as active as possible. I said them, but you should probably say us. Identifying and treating any accompanying physical illnesses. Detecting and managing any challenging behaviors, because sometimes they may react differently to how you expect them to react, and you will not be aware of it. Education of the population is important to recognize these things, but also education of the caregivers and the family to recognize the illnesses that the relatives may be actually getting. So that is it in a nutshell. You asked some questions already, but I'm sure if you have any more, feel free to answer. So, Caribbean Wellness Day, chronic non-communicable diseases.
To what extent can physical ailment impact your mental health? I know there's a connection, but what are you seeing in terms of that in your practice and from your experience?
You know, sometimes people have physical ailments and they think they are trying their best to do all the right things and When they go to the doctor says, or sometimes doctors even quarrel. I used to quarrel one time with people. So it can affect you mentally. And the mental problems can affect the physical ailments as well. Because if you're not, I mean, some people, relatives would tell me about somebody whose memory is going. But when they come to see me, I don't recognize it because they're prepared and they talk like if everything is good. So there's a connection between the physical and mental illnesses, a direct connection. So you need to, everybody needs to play a part and recognize what is going on so that they can better help the elderly.
This is a little close to home to the younger ones. We are crying about healthy eating, but there is particular fast foods outlet which is really doing the dog in terms of business. What on the menu would you say people should not take on these fast foods?
Good question. I don't know what the menu is. I'll Google that. But anyhow, let me admit something. I think it was 2 weeks ago. I was in Grand Bahama, one of the Bahamas islands. I left Barbados, went to Trinidad overnighted there. Went from Trinidad to Jamaica, Jamaica to Nassau, Nassau to Grand Bahama, and did the same thing in reverse. When I left Grand Bahama early in the morning, 6 o'clock, to get to Bahamas, to what we call the Nassau, I didn't have any breakfast. So I went to look for breakfast. So a guy showed me somewhere down there that they're going to buy things. I said, that don't look too healthy to me, a little hut somewhere down the road. So I had Dunkin' Donuts for breakfast. The flight never left till 2 o'clock. So I had to eat lunch. And you know, they don't serve you anything. I had KFC for lunch. Tasted bad. Lot of salt. Greasy. But when I got to Trinidad, it was 8:30 night. So at the airport, I asked, where can I get a roti? He said, you can't get roti at this time of night. So when I got to my hotel, I saw a place called Popeyes, another fast food. So I had Popeyes for dinner. My mother told me don't go sleep on an empty belly, right? So you asked about what's on the menu. There are many things on the menu of those fast food places that you can really eat. I saw garden salad or something salad in the Popeyes. But when I looked around in the place, I didn't see a large number of people. I said, they might have had that there for a little while. I ain't taking no chance with that. And that's why I took what I took. I asked for sorrel. I thought I was going to get sorrel. I had sorrel drink. So there are many healthy things, but the salads are probably the best things that you can get in the fast food place. But you know, everything is fast, so it's fried this and fried that. Or somebody told me to have lentil rotis. No, I didn't even know about that. So they have veggie burgers. But I don't frequent those places usually at all.
Doctor, food is cultural.
Yeah.
We like putting on sauce on salads. We like stew. You know, we like certain. How do you break this cycle?
It has to be done gradually by education, serving sizes. Because if we eat smaller amounts of these things, as we eat too much, serving sizes. And nowadays, in some restaurants, they tell you to refill the glass. I was in Florida, I think around July or so. And when you buy a Coke or something like that, they encourage people to come and refill all the time. So serving sizes and education. And you need to have suitable alternatives as they're trying now with this sweet drink taxing, water Wednesdays and something Fridays and those sort of things. So we got to start at that level to educate the persons. You see, you all remember when McDonald's came to Barbados and they had to play a part. Then Chefette start with play a part. And Chefette has gone all over the place with play a part. So when you have a children's birthday now, you go to Chefette. So there's insight in their mental psyche that this is the place to go. So when those children get children, it is Chefette. And that's why they have done extremely well. So they make it easier, make it attractive, make pretty colors, and so on. So it's difficult to reverse all of that. But I think we need to speak to everybody, speak to your friends, your relatives, and teach your children from early o'clock. And we must also have self-control. And don't encourage the macaroni pies on Sundays. Yeah.
Good afternoon.
Good afternoon.
So I was told that the elderly basically eat healthier, but you were seeing a high number of level of diseases and among the elderly. So I'm wondering, is it that they eat healthier, or is it that the medicine at the time wasn't as high as it is now to detect what's really going on? Because we, and in my opinion, the elderly are eating all the same way now, what I see. So is it they healthier, or medicine wasn't there yet?
Well, good question. I'm gonna answer it in a different way. The elderly amongst us were a lot more active. If you listen to Larry Mears on Saturday mornings, you will hear some stories that used to happen in the old days, where they used to have to walk long distances from the bus stop to get home. Nowadays, the ZR will stop right in front of your house, or right in front wherever you are. You don't have to go to any bus stop or any stop at all to get anything. Children during the summer never used to be on tablets. We were trying to cut children off the screen time until COVID come. And we said everybody must have a tablet, right? So now they're always on a phone or tablet, because that is what has happened in the last 2.5 years. Just before that, we were saying cut down on screen time to half an hour, this thing and whatever. During lunchtime, we used to run out and play football or cricket at school. Or those of us that live close to the school used to run home for lunch and come back in time for the next session. Now, this can't even leave the premises because security guard on the premises. The parents can't come in and bring in anything. So it's unhealthy foods that they may get or they may be encouraged to get. And whenever anybody gets any achievement, they're going to celebrate at a fast food place. After 11 plus, you know, all the fast food places are fully patronized by all these things to celebrate. So we have a different mentality, a different society that we're going as opposed to in the old days. Because of increased access to various health facilities, various medications. We don't want people to be totally dependent on medications. But if you look at any of my slides, you see I talk about diet and exercise and stopping alcohol and stopping smoking. And at the last thing, last round in the ladder, if all those fail, it's medication. My father had a shop, And he used to sell salt fish and salt meat and red herring. They had a lot of salt. But those people, when they left there, used to walk from Robert Street into town and then catch a bus to St. Philip or wherever they went to. And then walk from there with a box on top of their head with their food items to cook for the week. Nowadays, everybody has a car or access to public transport, which is now become more reliable. You have electric buses. We have improved public transportation system. So people are less active. We have television sets, so we can sit down and watch anything going on in any part of the world. Before we had to go to a Globe cinema or mobile cinema to see what's going on. So there are a lot of changes in society that has occurred that led to the inactivity that we are seeing, and therefore the increased number of cases of illnesses and diseases. There is more detection because of technology, but yeah. Yes, sir.
Breakfast, lunch, and dinner. I might be so too old to catch up with her now. But what would you say would be a good meal, breakfast, what do you have for lunch, and for dinner in order to keep your body in check?
All right, I'm not a nutritionist, but fruits at every meal, and the nutritionists tell you how many servings of fruits you should have per day. And the nuggets and things like what the young people like, and hot dogs and burgers. Those are not good breakfast items at all. Some oats, oatmeal is good, right? But people can't take, I don't have a problem with breakfast. But I take the same thing Monday, Tuesday, Wednesday, Thursday, and Friday. Same thing. Every Saturday, I take the same thing that I take every Saturday. And on Sundays, I take the same thing. So I know what my menu is every day. And when I travel, the same thing happens. Except one day, the last day, I can take an omelette. If I'm a good boy or whenever I'm there. So if I go to a hotel, I'm looking for the same thing to maintain my breakfast. I'm not going to say, oh, there you got to pay for it, or you pay for it, so let me eat it. I eat the same thing every single day. But that's discipline. So that type of thing, fruits, cereal, some type of cereal, without sugar or low sugar. If you're diabetic, no sugar. You can take the eggs, the egg white is okay. The yolk is the one that's full in cholesterol, so you have to keep frying the eggs, especially if you use the egg then boil. But don't take one every day. So those are things. Sardines in water or tuna in water rather than in salt is also options that you can use. So there are a number of options that you can use, but look at the labels and see what the caloric value of these various things are, because you'll be surprised to see how many calories, and know also what is one serving, right? A serving, how much is a serving size of these various things that you're using. And the teas could be herbal teas or green teas, or if you want to have your coffee, but don't go and put condensed milk in it, right? So those are some of the things you can take to help to keep you going. And then of course at lunch, you can either have something light, or if you prefer to eat something heavy, and then something very light in the afternoon, or snacking in between the day, or small frequent meals is also another thing. You can spread your calories out, so you don't work that poor stomach and then get all the acid reflux.
You actually answered part of the question that I was going to ask before you asked the other question. My grandmother always told me was growing up, don't eat heavy at night. That's good advice.
Probably then. There's truth to that too, because eating heavy at night and then lying down likely to give you more acid reflux. Anything is not going to affect your heart. People that she may have tried to tell you at that time. So, yeah.
The other nitty gritty thing is pork is one of the sweetest meats. Oh, I don't eat it anymore, right. But is this? They talk about red meat, right, and so on. Is this a meat that you would is all right to eat? Pork.
Pork is the other red meat. It's also maybe high. I'm not sure the cholesterol value in it. We talk about red meats as the ones that cause a lot of problems. But chicken and fish is better things to use.
Because I'm
They never
told
did
that like beef takes a long time to digest and things like that.
Yeah, it does.
Yeah.
But also, the cholesterol level is also high.
I think it's you that stopped me from eating ice cream. I remember some years ago I went on a cruise. When I came back, I had an appointment with you. And when I got to your office, my sugar was high. And I told you I had eaten ice cream before on the ship. So he said, well, what you said, when you come to me after you eat ice cream? That was the reason why, because I felt like that if you eat ice cream, your sugar can go up, right? Is that so?
Yeah.
So ice cream is not good for me. I like ice cream. I stopped eating ice cream since then. That's a long time. Why you sit once in a while I eat ice cream? So is that not good, especially if you got diabetes?
Well, it's all about calories in and calories out. So if you eat ice cream, then you got to cut out something else in the diet that day. You know, there are festivals, there's Christmas, there's Easter, and so on, and family gatherings, and so on. And what we are guilty of is that we don't want anybody to know that we have any calorie restriction or food restriction, so we eat some of everything. You might have ulcers, and you know you're not supposed to eat alcohol, but you drink it with the fellas. But I gotta enjoy this thing with my mother and so on. Thank you. So it's important to monitor, and when you do those things, check and see what your sugar is, so you will know how to adjust things in the future. So it's important to, if you do cheat, you need to cut back on something else to balance it. Because ice cream, like sweet drinks, have a high glycemic index. So it shoots the sugar high up quickly. And when the sugar gets up high, it could cause damage to the various organs. And I don't think you want any of your organs damaged, right? Huh?
Have you listened to the folks who reached 100 years? They're all wanting in them speech. They eat enough wrong provisions, drink brandy, and work hard. Nowadays, young people not working hard. Much being children going to school. At lunchtime, the funny pastor sitting down or in the classroom with a tablet. And we encouraging people to eat healthy. But healthy food is expensive. Healthy food is expensive. I'm not with COVID. There was a doctor in St. Lucia that treated her patients that come to her with COVID, that had COVID with some drug. And because it wasn't on the drug formula, the council suspended her. And she called the court and won the case. I feel that there's a cure there for COVID, but these people don't want you to use the cure because they want the people to take the vaccines and all that such thing.
The solution, solution situation, I think, was hydroxychloroquine that were being used, and more studies had shown that is not effective in the treatment of COVID-19. You know, some people have COVID-19, have no treatment, get better. Some people have COVID-19, get treatment, get better. Some people get treatment and don't get better. But the studies have shown that there is no effective, or that was not effective treatment, and that they were protecting the society, and she was born, but she is one of the alternative medicine practitioners. She's a qualified doctor, but she practices alternative medicine. I'm trying to remember her name now. That's why she was thinking. Obviously, the court looked at it from a different point of view, and hence she won the case. The other thing about children, the food, the ground provisions, they're very good because they have a lot of fiber, so they don't send up your sugar and so on so fast. They work a lot slower. That same yams and breadfruits and sweet potatoes and so on. So that's what they do. A glass of wine or brandy and so on. I remember my father, every evening when he came home from work, he would have some Hennessy with his dinner. He lived to 83, I think it was. Yeah, 83. So these things in moderation might or could help some persons. Other persons it might not. So we have to look at individual cases, but in the older, but then as I said, they work hard, they burn off all those calories that they took in. So it get them busy and so on. And therefore we have in Barbados is number 3 or number 4 in the number of centenarians in the world. Guadeloupe has the highest. I think Martinique is second, and then Barbados third. We have some 71 per 100,000, I think it is. Centenarians in Barbados. USA has 29. So you can see the difference. And they've been studying to find out why it is that we do so bad. Yes.
I lived in a family situation where you had grandparents, parents, and children. And the children ate whatever the grandparents were eating. So if today they cook ground provision, then everybody ate ground provision. But we're living in a society where it seems like the children determine what they want to eat, the parents determine what they want to eat, and the grandparents determine what they want to eat. Given your experience dealing with seniors and their health issues, what is a good middle ground? Should we lean, for me, I think we should lean towards the type of meal plan that our seniors would use so that the children would benefit, but there seems to be some tussle and struggle in trying to adapt to get it right, especially when the family unit is more extended. What is your advice?
Yeah, I think we should go with what the seniors want. We can't let the younger people dictate what they should get. And we are too accommodating, and therefore we are suffering the consequence. Because when they do that, when they get older, their children, they're not going to go and take what the older people get. They're still taking what they were getting when they were younger. The younger children are getting worse food. And therefore, we're getting a number, like type 1 diabetes. Used to be called juvenile diabetes. You hear younger people get diabetes, they're type 1 diabetes. Type 2 diabetes is what used to be called adult onset diabetes, where it's found in adults. But now, because of obesity, which is a big problem, we're getting a lot of children now who are developing the diabetes that's not inherited, so to speak. That is inherited, but because of their size and because their lifestyles have changed. And we've seen that over generations in not only Barbados, in the Caribbean in particular. So we need to try to find a middle ground to make everybody happy, that they can look after the health of themselves and the health of the nation.
Today we're using a lot of euphemisms to describe obesity. And therefore, this language has become so accepted that people now don't see a danger about it. You can't call a woman fat anymore, right? You can't use that word that's not politically correct. So therefore, if you use the word fat, associate some sort of disease with that. So you're calling them, what's the word they use now? Big, thick, and big bone, and that kind of thing. So how would you see, how dangerous is that will feed into the dangers of the diseases of obesity?
Yeah, very good point. That can lead to a false perception out there, because that person who you might call pleasantly plump feels good and thinks that there's nothing that he or she needs to do to lose weight. It's not easy to lose weight. During the lockdown, I lost weight. People say, oh, you could lock down and lose weight. I was conscious of the fact that I was at home. I was conscious of the fact that I was less active. I couldn't go where I wanted. So I did things to consciously reduce my caloric intake and increase my activity. And I've been exercising all along. I go to the gym 2 days a week, and I said this morning I did a walk. Yesterday I did a 5K run. I never could do that before. So it was just about discipline and graduation of exercise. I started exercising in the house. I started exercising around the house. When you say you could go further, I started working in the neighborhood. And then I went a little further and a little further. And now I could easily run a 5K without even having to have a glass of water during the thing, which is not a good thing. You should keep yourself well hydrated. So much so that this year in the Run Barbados, I've signed up already to run the Run Barbados 5K. First time I attempted it. Hope I'll finish it. It won't be last time either. But I've learned something in 5K is never look behind to see who behind you.
So you said that you were home and you were able to lose weight.
Yeah.
So the question had originally ties into this. Now we live in a society where time is, well, we don't have anybody else's time. And food is being the fastest food to eat. Quick food, get done. And that leads to a rise in everything. In your opinion, what would be the best fastest foods to get to eat? Does that make sense? Quick food to get that is healthy, because you got time and you still want to eat healthy.
I'm not a cookist. But, it was yesterday or the day before, somebody told me, I'm going home. Yesterday, I'm going home. I'm going to cook some chips and something else, I don't remember. Because that's the quickest thing I can do. So frying something is easy and quick to do, but not healthy. So what is healthier? The faster foods are not necessarily healthy. And what we need to do, or what you need to do in that situation, you need to cook ahead earlier in the week when you may have time, if you do have time, so that you could refrigerate and heat those things when necessary. I think that's the best answer to that in order to accommodate, because you might be working and then studying after work at university or college or wherever, and you don't have time really to think. Going between work and classes is easy to stop, get a hamburger, a hot dog, or something so to keep you going. When you get home, you're too tired to cook anything proper or to spend time cooking. So that, I think doing that might be helpful, might not be always practical, especially if you have a family home that somebody might want to eat out your food that you had there before. But it's important to plan ahead. So as far as cooking the healthiest things, there's some foods that are pre-cooked, or soups and that type of thing that you might be able to use, but you can't do that every day, right? So canned things, you have to watch your salt intake in some of those canned foods. So I can't give you a formula that will satisfy you, but you need to look at it individually till you get what is suitable and satisfactory to you.
Listening to what you said and hearing all about the sugar thing, the news. If you eliminate sugar from your diet, what happens? Does that really help the body, or need to have sugar in the body?
You don't need to have added sugar. You get sugar from those same foods that you mentioned. You get sugar from the yams and potatoes and high fiber foods. They are manufactured into sugar as you go ahead. So you're still able to get enough, and then your body can cause, there's a hormone called glucagon that can cause the body to produce sugar if you need to. And then it's the adrenaline that also can help to cause you to produce that extra sugar. So your sugar not will go too low. Your body can accept the carbohydrates which turn into sugar to give you the energy that you may need. And I think that's the perception that people have. You still need a bit of sugar. And by the way, sugar is in glucose, but also in sucrose, also in maltose, and sugar is in all these other drinks that you may not recognize. The amount of sugar in the unsweetened drinks, it means that they didn't add, so no added sugar yet. They didn't add any sugar because sugar there already, and too much sugar may be there already. So you have to be very careful with no added sugar things. Look at the labels for the glucose and fructose, and maltose, and the other O's that may be there that could make you think that you're not getting any sugar.
Quickly, one of the things that you mentioned in your presentation was the importance of exercise as a means of dealing with some of the issues that we have. As it relates to our seniors, many of them are quite comfortable not doing anything, or if anything is done, the minimum among the house. How do we, as a man of faith also, you would have had different interactions. How do we get our seniors to be more active rather than just sit and wait or relax or whatever? How do we do that?
Another good question. The church can do it or can encourage physical activity. Some of the seniors will have mobility problems because of arthritis, but once you get up and move, it will help the joints move a little bit more. So it could be a mobility problem, but you can have like dance classes at the church, or encourage them to get up and move. You can have some activity, walking activity. You can have them, if they are not averse to it, the sea, non-weight-bearing exercises, if they can go to the sea and move around in the sea. Those are things that you can use, of course, cycling if it was possible. And those people that are more agile, then they could do things like skipping. So dancing, walking, swimming are good forms of exercise. Gardening is also a physical activity. Sweeping around the house, those are things that one can do. The days are very hot now, but you can do it early morning, late evening if possible. So you can accommodate that and adjust in order to get whatever benefits that you need to get.
So in relation to the question pastors asked concerning elderly folks, so retirement age is somewhere around 70 now. And I've been wondering about that for a while, because it's about, you have average around 30 years doing nothing at all. To me, it doesn't really make sense, because you don't do nothing less 30 years just there doing nothing. And I realized that a lot of elderly, after they retire, that retirement age is blocked in, like, okay, I will stop work. Do you think that should be? Because you start work, you believe, okay, I can't do this, I can't do that. But there's some people who are doing past 80, doing things that 16-year-olds can't do. So I'm wondering, do you think that retirement should be it? Does that make sense? Should be it.
I think retirement should be active. I don't see it nowadays, but Emmanuel will tell you that whenever somebody retired, they gave them a lounge chair, a recliner, to stay home and lay down, or lounge chairs. But I have a friend who retired and gave her an exercise bike, so that he would be active. So retirement is not the end all. You cut off everything and go home and lay down and wait. But when your expiry date comes, it should be active retirement, because that way you'll be active aging. I think that's what we need to do. Exercise benefits you a lot. It reduces the chronic NCDs, the mental illness, the stress, the cancers, all that can be improved by physical activity. And then the social interaction is also important as far as exercise is concerned. Social interaction is very important as far as church is concerned. On Wednesday, I'm going to do I'm moderating a panel discussion on returning to church, safely, safer to return to church. Because we need to encourage people who have benefited from the online church services, staying home in their living room, dining room, kitchens and bedrooms, even the bathrooms. In the somewhere church closed, but some might be in 90s or whatever, and watching, and they're comfortable, and they're scared to come out because of COVID is killing us. As I showed you in the slide, it's over 70s that day, and if you're over 70, then I stand at home. So how do you get them back into a church building? I mean, church is not just the building. How do you get them back into the church building? How do you get back into socializing? How do we get back out to them as well? So it is a matter of working to find out what is the new norm, so that everybody can benefit from the benefits of socialization, which is important.
Right, thank you so much, Dr. Lord, and this is very, very informative and instructive, and I'm sure we have had a lot of food for thought, and I don't think this is the last we will see of you. You are like no, how should I say, an honorary member of KFL Wesleyan. So I want to thank you so much, and I want to thank all those who also came out this afternoon and benefited. We have recorded this, and this will be on our site. So those who did not come out, and those who are out and want to see it again, in short order, it will be on our site, and we should be able to see it and listen in the comfort of our homes or wherever. Thank you so much again.